A new report from the Robert Wood Johnson Foundation, which is a nonprofit focused on health, is showing Iowa is 4th in adult obesity and 10th in youth obesity out of all 50 states and the District of Columbia. KIMT News 3's Alex Jurgens visited Charles City Middle School today to find out what's being done to curb the issue. Alex?
Amy, childhood obesity is a very serious concern, especially considering that the CDC says it can lead to a number of other health issues like sleep apnea, asthma, type 2 diabetes, and joint problems. Now, here at the Mason City YMCA, kids and adults can come here to get in some exercise and burn off some of those calories. And, I spoke with a physical education teacher to see what Charles City schools are doing to help students stay in shape and create lifelong healthy habits. Carrie Jones is a parent of a 12-year-old daughter and 10-year-old son. One thing on her mind is if her kids are getting enough physical activity in the day.
My two children that are here are not real sports oriented, but knowing it's true physical education for the children and for the kids.
She says Iowa's high rank in terms of obesity is quite surprising.
In general, people kind of view us as that farming community. People are outside all the time working hard, and we are, but times are changing, and when kids aren't at school, there's lots more opportunities for them to be doing more stationary, not physically active activities.
According to the Robert Wood Johnson Foundation, the rate of obesity in Iowa's youth aged 10 to 17 is 17.7%, ranking it 10th in the nation. In adults, it's even more, ranking 4th with the rate of 36.4%. In Minnesota, the report found it's a little different. The obesity rate among youth 10 to 17 is 48th in the nation at 10.4%. In adults, Minnesota ranked 35th at 28.4%. Rusty Rogotsky is a physical education teacher at Charles City Middle School. In his classes, students wear watches that detect movement and heart rates in real time.
It's a wrist-worn heart rate monitor, so the kids come in at the beginning of the year, we get their height and weight, put it in a program that computes their BMI, and then adjusts what their heart rate should be.
The watch has 3 color-coded zones, with blue meaning resting heart rate, yellow is more moderate activity, and red is high-intense activity, with the goal to be met each day. And so far, the kids are liking them.
I think we've noticed there's much more engagement from the kids because now they have responsibility. I don't have to run around the room saying, you need to work harder, you need to work harder. I go around the room and I say, what color is your watch? They look at it as blue, and they kind of, oh, I got to get going, and they take care of that themselves.
Jones says she wishes this technology was around when she was in school.
This would have made a big difference.
Now, Mississippi topped the list for childhood obesity, while Utah had the lowest rate. Live in Mason City, Alex Jurgens, KIMT News 3.
Thank you, Alex. Coming up tonight on KIMT News 3 at 6, we'll take a closer look at what could be contributing to the high obesity rate in Iowa. When we come back, we'll take a look at your weather forecast, plus